All right, so we're here with two great visitors that have come to Madrid from London, Craig Nightingale, and from Brazil in Fortaleza, Rebeca Hamdan. Okay, so thank you so much for coming over all the way from UK and Brazil. We've done a facelift, a deep plane facelift, and a neck lift. So the first question is, we'll go right into introducing you formally, but just right out of the bat, what do you guys think about the surgery we did today? It was a bit long, but what do you guys think about that?
I think it was really interesting. I think I've always liked the way that the way you do your procedures. You have a method and a thought process, and there is a reason why you're doing something specific, and it works. It's logical. It makes sense. So I really enjoyed seeing, the real substantial improvements that you get to see from those type of maneuvers, and you say, okay, well, it just makes sense.
Right, adding several kind of maneuvers.
And it was the detail and the some of the little steps that not everybody does. I thought that was really useful. It's useful for me to sort of see how you do those things. So it's great. So I'm very grateful.
Thanks so much, Greg. Rebecca, what do you think? Yeah, you've done seen a lot of facial surgery too, like Craig, right?
So a great surgery and great results. And for me, is the opportunity. So I'm very grateful to be here, and you share your knowledge with us.
Thank you. Yeah,
thank you so much,
Rebecca. Thank you so much. So I'm just going to go through, because it's so interesting today, because both Rebecca and Craig, they had an incredible training. I know both of them from meetings as well. So they've had the best training in the UK and in Brazil, and they just finished recently. But this just shows how when people have good training, it also makes them kind of more committed to trying to get even better training abroad and going to see plastic surgeons, right? So this is a great example. But just tell us a little bit, and we're going to go through what you guys did already, and then maybe tell us what you have in plans, because you just finished your training. But of course, very, very advanced plastic surgery training in UK and Brazil. Go through. I think you were in Birmingham, right?
Yeah. So I've just finishing my training in Birmingham. It's been a 6-year process where we cover all the aspects of plastic surgery. So burns, hands, sarcoma, breast recon, head and neck. The aesthetic stuff is sometimes a bit harder to get the experience of in the NHS. And so broadening your experience, whether that's at home or certainly coming abroad and seeing how different people do things, I think it's very easy to become stuck in a small echo chamber where you only see what is happening around you. And you almost convince yourself that is the only way to do things. And so coming away to other parts of the world, seeing other people, seeing how other people do things with other ideas, I think it's crucial.
And I think also that coming from seeing such a complex surgery like you are in the NHS, where the quality of training in reconstructive surgery is outstanding. You guys practically, I won't say invented, plastic surgery with Gillies, right? But you do have that culture of really intense reconstructive plastic surgery. But what's good is also that you are able to recognize complex aesthetic plastic surgery as well, and you decide to sort of go out and see that type of surgery with respect, not kind of looking down at it. Because when you're used to doing like these complex micro cases or craniofacial surgery, sometimes you think, aesthetic plastic surgery is I don't need to learn it, right? But it just shows you that you also understand how complex that is.
100%. And I think the nature of the two complement each other perfectly. So I don't think the two are entirely independent. And I think if you can be a very good reconstructive surgeon, there are skills there which cross over to aesthetics and vice versa. And actually that complements both the other way. So you can bring aesthetic elements into your reconstructive practice and vice versa. And it makes you whole a whole lot more rounded,
Yeah.
a lot more confident.
Exactly. Yeah.
So-
No, definitely, Rebecca. You also people when you think of Brazil, people think, of course, of aesthetic plastic surgery, but what a lot of people have to understand as well is that your training in reconstructive plastic surgery is
training
really,
in Brazil.
and you also you train mainly in Fortaleza, but you were telling me you were in a very large university hospital with a lot of reconstructive surgery as well.
Yes,
No?
my
Tell me about
training
that.
included both reconstructive and aesthetic surgery.
Wonderful.
Hand, breast, and trauma, surgery trauma, and included all. But my passion today is the aesthetic surgery in facial neck surgery. and
Okay,
neck
face
surgery.
and neck surgery, right?
Yeah.
No, it's good. It's interesting that sometimes some surgeons already kind of see their, provides them enthusiasm, right? Like you're saying, you sort of started, you were telling me before, like also with interest in body contouring, which is so complex nowadays with all the energy devices, right? But then you found your way into facial aesthetic surgery. How did that happen, Rebecca? Como aconteceu? Sim, vai falar em português. Sim.
Nesse momento, no meio da residência, acabei me apaixonando, vendo muitos cirurgiões incríveis como o Dr. Bravo. Alguns cirurgiões acabam inspirando a gente de uma forma muito diferente. E ver algum deles, como você, fez assim reacender uma paixão pela cirurgia da face, principalmente. Então, alguns pontos na cirurgia do Dr. Bravo são muito diferentes. A forma como ele enxerga a anatomia da face, do pescoço, como ele consegue a naturalidade nos resultados, como ele consegue definir o ângulo da mandíbula, mas principalmente a forma como ele enxerga essa anatomia é algo muito, muito diferente. Isso mexe com a gente de alguma forma, e aí no meio desse caminho eu acho que eu encontrei essa paixão.
Sim, porque nós sabemos, visto a São Paulo recentemente, não? É um congresso que é muito grandíssimo, todo o congresso em todos os congressos.
Nos encontramos em Deep Play, no Brasil.
Em Deep Play, Brasil, em São Paulo. And again, I think that the opportunity to go to these meetings that are very advanced, even at a more, traditionally reconstructive plastic surgery programs are not very, likely to accept their residents going to aesthetic only meetings, right? But I think that nowadays times are changing, right? And I think they're not looking, or they're not forbidden as before, that you have to almost like hide, to go to these meetings, right?
Yeah, it's variable in the UK. Some are a lot more accepting and some are less so. Right. But I think the situation is evolving more into that very much an accepting perspective. And it used to maybe, I don't know whether it was fear of competition or what was going on in the past, but things are certainly opening up a lot more and people being a little bit more understanding. Certainly in the UK, it's part of our curriculum. We have to do some aesthetic.
Right.
But it's difficult, as I said, to get that experience sometimes. And the more you know, just with the type of people that we are, the more you know, the more inquisitive you become. And so you find more and more detailed. For example, coming here,
right?
Okay, you know how to do a facelift or a neck lift, but fine-tuning those small details that just give you that few extra percent.
Of a reliability on something that is so complex to just provide results day after day, with very complex procedures, right? How about in Fortaleza? Is that also hard? I mean, you have excellent training both in aesthetic surgery and reconstructive surgery. Is that common in Brazil, though? Are a lot of the chiefs of the departments? No.
In Brazil, many service and hospitals and just aesthetic surgery.
I see.
We need to come to Brazil.
Yeah, just aesthetic plastic surgery.
Solamente cirurgia estética. Mas no meu serviço, realmente é um serviço muito completo, é um hospital muito grande de trauma, referência de trauma, de toda a região Nordeste, uma região muito grande. Uau. Então lá o treinamento foi realmente muito amplo. Microcirurgia, cirurgia do trauma, cirurgia reconstrutiva de membros, mas é algo um pouco diferente. Em muitos serviços, os residentes aprendem só cirurgia estética. É a realidade de muitos serviços no Brasil, principalmente Sudeste, Sul, Sudeste, alguns vêm apenas estética. Mas eu acredito que essa parte reparadora
É muito importante.
Muito importante e faz a diferença. A gente traz uma bagagem muito grande para a cirurgia estética da face.
Yeah. She was saying that brings you a lot of knowing that reconstructive surgery, provides knowledge of anatomy, of handling tissues, of handling bleeding, or of patients in the OR, right? Because some of those cases are long, and nowadays to do good aesthetic plastic surgery, you can't rush a case and just go fast, huh? So a couple of questions about what you are intending to do after you just finished, right? So I know that you already found your passion, which is facial aesthetic surgery, Rebecca. I think you are also, very knowledgeable in aesthetic plastic surgery around the face, but you're going to continue a little bit more with your training in reconstructive.
That's right. So I certainly, if I end up working in the NHS, you have to do an NHS practice, and that would be from a head and neck reconstructive point of view. I've already for years now been doing a non-surgical aesthetics thing in the UK for quite a while. So I want to advance my reconstructive skills and also develop my not just confidence but competence in aesthetic surgery. I think that you can be one without the other sometimes, and I think it's good to have both. But from a long-term perspective, it would certainly be trying to combine the two, utilizing skills from both sides of that to complement each other. And as you said, anatomy, some of the cases you see in reconstruction can be terrifying.
Very difficult.
And then you come to a aesthetic case and you think, oh, this is really difficult, but actually, I know
you bring
how I can bring some of
different maneuvers, different tools, right? That have helped you in the back, in the past, right? But so then you're actually going to go actually to Australia. You told me, right? That's great.
I'm moving to Melbourne in about 5 weeks.
Nice,
congratulations. So going to be there for a year. Thanks.
Oh, that's wonderful.
Might then go up to Brisbane for a while, if all goes well. Might stay there, might go back to the UK. It's very unnerving not knowing what I'm doing for the next few years.
Congratulations, Craig. That's exciting. And of course, Australia, you just mentioned, Australia is some of the places. Hello to our friends in Australia there. We have so many friends there, and their training is outstanding as well. So that's going to be a great opportunity to, both in reconstructive and aesthetic plastic surgery.
I think so. I think it's difficult in the NHS now with financial constraints on the public sector. And more trainees are coming through with less and less experience, and getting the opportunity to go to other countries and see how they do things and get that extra hands-on experience is really important.
Yeah, great. No, that's excellent. How about you, Rebecca? You're already set up because you already understand that you want to go full throttle with facial aesthetic surgery, right? So what are you going to do then? You just finished, right, a few months ago. You're incredibly well trained. You did general surgery before going into plastic surgery. So tell us what your plans are. You're going to start your practice. You're going to join a practice already. What are you going to do?
Acabei apenas 3 meses a residência. Eu auxilio um cirurgião, mas também já tenho consultório, né? A gente vai começando devagarinho.
Parabéns!
Obrigada. E é isso, dá vontade de voltar para o Brasil e botar em prática tudo que a gente aprendeu aqui com você, mas como você falou, há uma diferença que é importante entre assim, ter a confiança, mas também ter a ciência de que você tem a habilidade. Então, algumas coisas, claro, ainda estão além, são mais avançadas, que eu acho no deep. Mas é isso, todo dia aprendendo um pouquinho, com quem sabe mais do que a gente, como o senhor.
No, I think that when you have a great training, it's just a matter of building your confidence a little bit more. But you guys are great surgeons already, so I think you're ready to start, getting into these more complex facial aesthetic surgery procedures, right? But one thing also that's also interesting, and that's why I like that you came to see me and to see such a difficult case that we just did in the neck and the face. And I think we were talking about this before, because some people think that they need to start off with different techniques that are simpler, and I do not agree with that. So I think that the first thing to do is to get an outstanding training like you both have, and be confident with your surgical maneuvers, with complex anatomy around the face, around the neck. But then you have to do the technique that yields the best outcomes, right? And sometimes they're not easy to perform, right? But that's why you're well trained, and that's why you came here to see these procedures. Like you're going to meetings where our procedures around the face, definitely, but all around, the body, the body contouring, the breast surgery now, the rhinoplasty surgery is very, very complex and requires a lot of commitment, in your training. That's why you have to travel. So you maybe do cadaver courses, dissection courses, but you have to do the technique that's best for the patient at the end, because we need to provide results for our patients, right? So
I think so, 100%.
What do you guys think about that?
I completely agree. I don't think you can compromise on doing a moderate job when something needs to be done properly. And that's the whole ethos around surgery in particular is, it's an apprenticeship until you retire. You're always learning.
Oh, definitely.
Always
it's a journey.
learning. And so you do these things, you have someone come and help you and show you how they do theirs, or you go and watch them, take little bits, and it grows and grows and grows. And you can't offer particularly in the private sector in aesthetics, but certainly not in any sort of reconstructive concept as well.
Definitely, yeah.
You can't do a simple job if it's not the right job.
Right. If it's even in reconstructive, you got to provide. If you have to do like a DIAP flap or a micro case because that's the best, you got to do that. You can't.
You can't just put a skin graft on.
Right. And just that's it. We did reconstruction. No. How about let me ask you, Rebecca, what do you think about, because you're staying in Fortaleza, right? Which is a large city, right? I think it's like about 3 million people. It's quite a large city. I mean, Brazil is huge, right? Any city is huge, right? But tell me, because you're also going to be very focused into facial. You like facial surgery. Are you also going to provide breast and body, or are you going to try to focus on? Because sometimes the question is, will you be able to survive in private practice alone, only committing to one specific area of super specialization like facial rejuvenation surgery in a smaller city? That maybe there's not enough surgery going on, versus like a city like Sao Paulo or Rio that there's so much surgery going on. What was your decision to go into Fortaleza?
The beginning, I ainda faço dos dois, mas queria me super especializar em cirurgia da face e rejuvenescimento facial. Eu acho que esse é o caminho, né? Hoje todo mundo tende a escolher uma especialidade e acho que quanto mais você faz uma coisa, melhor você fica nela.
Sim.
Então, hoje eu ainda faço um pouco de tudo, até porque eu ainda gosto muito de tudo e é o começo, né? A gente passa tantos anos ali estudando, aprendendo, eu ainda tenho um medo de largar muito cedo, mas a intenção, à medida que você for tendo seus pacientes, é eu ir me especializando e ficar mais na cirurgia da face.
Da face. No, but I agree with you also that at the end, you have a good training also in other types of surgery. That's not going to be a detriment to your being a worse, surgeon around the face. And the fact that you know how to do a breast augmentation is not going to say, oh, you're not committed to. No, you learn how to do it. You do a good job in breast surgery. But eventually, of course, the more you're in one area, then you gotta leave other surgeries behind, right? But I think what do you think about that?
I do agree, and I think it's very easy to be, in English we call it jack of all trades, where you do everything and maybe not any one thing exceptionally well. I think it's good to be able to cover the whole spectrum of aesthetic surgery and to be able to offer those. But there are times when, if you are a facial aesthetic surgeon, okay, you might be able to do a breast augmentation or reduction or mastopexy or something like that, but you may focus more on the easier cases in those circumstances when it's not your forte, it's not your strength. So the slightly more challenging case, you may say, look,
refer it to a colleague.
Exactly.
And then I think that's that's more authentic and more honest. Once you even I've had an extensive reconstructive microsurgery background, but at this stage, I'm not. I'm going to see a patient that requires maybe a microsurgical reconstruction, then I'm going to refer to a colleague, because again, and that just goes to say, of course, more your honesty with the patient, saying, okay, if I have like very complex secondary case with rib, maybe someone that's only doing secondary rhinoplasty with rib, for these complex cases, it's better to send them to them, right?
I think, yeah. And I think you're not only, is it safer for you as a surgeon, it's the best thing for the
patient, yeah. Okay, so muito obrigado, Rebecca. That is so nice to have you here in Madrid with me. And Craig, thank you also so much. It's been wonderful. No, it was great having you. I really enjoyed people that have excellent training like you both have, and now you have the whole future ahead of you after all that training. Yeah. We'll be happy to see you again. Okay, thanks a lot. Muito obrigado, Rebecca. Okay, thanks.